So when we think about the digital supply chain transformation, essentially what we're saying is moving away from the old world view of just moving products and supplies, but also having more of a consumerism perspective to it, and realizing that although individuals who are in the healthcare supply chain may not touch the patients directly, we touch them indirectly. And also recognizing that the supply chain function should be the seat of innovation in most healthcare organizations. You're one, if not the only function that touches every aspect of the organization. And so from there, when we think about moving, whether it's meals or whether it's waste, whether it's linen, why is it that we as supply chain experts aren't involved in helping to negotiate those types of decisions? They're logistic activities, and logistics is a core component of the supply chain. And so when we talk about transformation, we're talking about transforming the mindset and the thought process of that. The digital piece is when we look at emerging digital technologies such as artificial intelligence, blockchains, mobile devices, wearables, those such things. We leverage them as a portfolio of solutions to enable the execution or more efficient execution of our supply chain processes. In order to be ready or prepared for this digital transformation, we got to take the blinders off. And one thing we have to ask ourselves is, when we look at our core processes, do we know what our 3 to 5 core processes, and those are things that we absolutely have to get right every day to stay in business. The other thing is, do we have a standardized process or mechanism in place to help us to recognize which of those processes need to be consolidated or integrated? And then the next thing we need to consider is, which of our supply chain, business, and clinical processes should we support digitally? We cannot support everything digitally, and we should not support everything digitally, but there are those that make more sense, and that's going to vary from organization to organization. And then the last thing we have to consider is, when we're talking about processes that we support digitally, let's also include those processes that are inter-organizational, those processes that go beyond the boundaries of our facilities, because those also will need some level of digital support. There are a couple of processes that come to mind that we have seen supported digitally. One is the procurement process. Typically right now we have our buyers or our purchasers, whatever you would like to call them, and they're the ones who are purchasing, sometimes purchasing based on things that are on contract, sometimes purchasing things that are not on contract. But the question is do they have the best information at that point in time to know how much to purchase and when to purchase? And so whether you're using these artificial intelligence appliances that are embedded into your purchasing and procurement systems to bring that information to the forefront so that they know exactly what to do and when to do it. As one CFO said, I believe I'm getting the best price, but what I don't know is, am I buying the right things, and am I buying them in the right quantity, and am I buying them at the right time? So digitally supporting or enabling that process. Another thing is, when you think about the logistics of supplies, whether we're talking about pharmaceuticals, whether we're talking about food, whether we're talking about linen, those types of things, we see more and more assisted robotics or collaborative robots, which we refer to as cobots, taking on many of those activities to move things around, thereby freeing up your human capital to do things that they're better talented for. I think digital disruption is a good thing. And it's not supplanting someone's space in the market. The way I interact with Amazon, or the way I interact with Walmart or any other company, I am not going to check that at the door just because I'm in a hospital. Customer service expectations are customer service expectations, and the level of technology that I expect to be at my disposal or part of my experience or part of my care, I don't distinguish between where I am. And so that's why I believe that disruption is a good thing, because it's forcing us to push healthcare further.